Welcome back, everybody. Once again, we are going to have a great conversation today talking about all things related to stress. This is a part of what we call here the triangle of health, which are the three major blocking points or stoppage places, roadblocks in people's health, whereby self-heal and self-repair. So as always, if you like this information, please share, follow, click, hit the little star below. That's how this information gets out there. And as well, this information is for educational purposes only. You should not use this. We cannot diagnose or treat any medical condition. And of course, you should always discuss all these with your personal healthcare provider. So Dr. Jenski, it's been a while since we last met and talked about stuff. I see you down the hallway and I'm like, hey, I haven't talked to you in like weeks. It's so funny, actually. You think
I'm in my pod, you're in your pod.
We just run around
seeing patients,
seeing people doing our thing and going home and keeping the crowds controlled at home as well.
Yeah.
So speaking of crowd control, today we're talking about the second thing in the triangle of health, which is stress. And so, this is one of the foundations of functional medicine. I personally found out in my career that stress, whatever that means, and that's what we're going to talk about. For a lot of people, they get 50, 60% better and not dealing with stress, whether it's trauma, whether it's medical stress or whatever that is, which again, we'll talk about, becomes their roadblock. Their body can't heal when their nervous system is stuck in fight or flight 24/7. And so what I want to talk about a little bit is what stress is. I tend to think about it scientifically, the psycho-neuro-immuno-endocrinology, which is a fancy way of saying how your brain, your mind is associated with your hormones, your gut, your nervous system, and how stress affects all those. And you can actually get a PhD in this field of psycho-neuro-immuno-endocrinology. So I know right before we went on, we talked about trying to keep things simple, right? I'm like, okay, this is not keeping it simple, but the gist is your brain, the mind-body connection. Yeah. It's now actually legitimate science. It's not woo-woo anymore. It's actually legit. What is stress? Because when we talk about that, just give us a buffet of what stress is. I think a lot of people hear the word stress and they're like, I'm doing great. And they don't realize, no, you have past stress leaching into the present. You have ongoing stress, trauma, limit kindling. Like what is stress? Educate us.
I think, again, everybody probably has a different opinion as to what that word actually means. I think the general definition of stress would be, a stimulus that elicits some biological response. And so in that same vein, you can keep it general, but also a stressor can be seen as something traumatic, physically traumatic. It could be seen as something emotionally traumatic. It could be a toxin in your environment. It could be a relationship. It could be financial woes. I mean, there's so many layers to it, each of those being a different stimuli that elicits some biologic response. And so when I think about stress, I think the one that everyone immediately goes to is that person is anxious, that person is quote unquote stressed out, maybe even burned out. They must be burning the candle at both ends. They must have a bad relationship. They must have some financial difficulties. But the reality is that is common, but not as common as some of the other stressors that we see in our practice, which is that patients have chronic disease, and that in and of itself is stressful. The chronicity of the illness, the lack of answers, the inability to feel validated, the physiological response that then leads to worsening health that impairs their sleep, which leads to more stress. If they're gaining weight or they're chronically in pain, they can't exercise, which leads to more body stress. So it just becomes this vicious cycle and loop of things that are piling on top that may have started with one or two little things that then just kind of built on it. So I try to look at it through a very microscopic lens on a patient-to-patient basis, but macroscopically, when you're stepping back to kind of see it defined in general. I mean, what do you think?
Well, I kind of think I like what you said about all those things. And as I was processing today, driving here, like how would I discuss stress with someone? I was thinking about, well, there's internal stress. Internal stress could be dysfunctional organs, like you've got kidney problems, liver problems. It could be your metabolic issues with your gut microbiome internally. Nutritional deficiencies. If you've got chronic magnesium deficiency, potassium deficiency, which the average American has, vitamin D deficiency, all those things are going to cause a low-level inflammation stress on your body. If you have a chronic infection internally, chronic Lyme, I've been seeing a lot of reactivated Epstein-Barr in the last 2 or 3 months. These can be internal stressors. There's external stressors. And external stressors can be people, family, events, trauma falls in there. And I kind of like, that's an external stress that internalizes itself, right? Mm-hmm. You have a life event, physical, sexual, emotional abuse, chronic illness, and all of a sudden now your brain gets wired into that state. Even you might be 10 years in advance, and your brain's still stuck in this environment. And then there's more environmental stress like chemicals, toxins, mold. Mm-hmm. And so all of a sudden it's like this ecosystem, of external, internal, and the ultimate result is they affect that's the brain-body connection, how your brain connects with your hormones, your nervous system, and all that stuff. And there's good thing about stress is it's not all bad. I mean, we need stress. Kids need to stress learning how to walk. If kids don't stress their nervous system, they don't learn how to speak. So we need good stress. It's just too much of a good thing can become a bad thing. And so that's kind of the way I think about stress.
Yeah, I mean, there's the concept of hormesis, right? Which is a beneficial stressor. The stress to a point without pushing past that point, with the net gain being that your body grows stronger, right? Like sauna or cryo or exercise or fasting. These are all hormetic stressors, but they're still stressors. Yeah. And so the body inevitably gets stronger because of it, or eustress, right? The term EU stress, kind of like when we say hypo or hyperthyroid, there's euthyroid, your thyroid is balanced. Eustress is what? The adrenaline junkie, the person that likes the way that they feel in a stressful situation and it's not proving to be deleterious on their health. There's so many layers to this. There's so many things to unpackage. And I like how you broke it out by external and internal, all of it being some stimulus, some stimuli that's collectively causing something. Is it just creating stress chemistry, or is it actually damaging an organ, or is it setting some cascade of events in motion that are problematic? And I think that that's a kind of a really eloquent way of looking at it.
Yeah. So, and I wrote a couple things down here. When people talk about stress, I feel like it's less hard to sell now. I feel like 10 years ago, telling people about stress, it was like, I have to sell you that this is real.
Yeah.
Because like everybody's stressed, don't worry about it. And so I wrote a couple things like Takotsubo's cardiomyopathy, that is a stress-induced heart failure, typically in women past menopause. I've actually seen some young women get it, but you get so stressed that you actually you get a cardiomyopathy, your heart breaks down.
You get left ventricular dysfunction without any known coronary artery disease. Yes. So you're not having a heart attack, but your heart acts like you have had a heart attack.
Yeah, it's really interesting. I think it was The Body Keeps a Score. It might have been the book I was reading, talking about, or maybe it was Radical Remission. I think it might be Radical Remission, talking about stress exposure and an increased incidence of breast cancer within 2 years of a divorce. So massive stress being associated, in populations with cancer. Stress-induced strokes. I mean, you've probably seen people in the ER, they come in, you get the workup done, they're younger, and you've had like stress-induced vasoconstriction. They get the stroke, their arteries are clean. We call it, vasospasms, right?
Yeah.
But you still got a stroke.
Or idiopathic.
Idiopathic. I always love that one. Idiopathic.
That means we don't know.
Yeah. And then there's the whole idea of MACE events, major adverse childhood events. These are things that happen in childhood. Seeing your mother abused, being sexually, physically abused, feeling unsafe. I kind of put things in there. I've kind of, I won't say I've made these up, but I've clinically recognized that being in a relationship with, or having a parent that's a narcissist. I don't know how many of your patients you've seen dealing with issues, and it's like,
too many.
Yeah, it's crazy common. But these are things that people can resonate with. Like, oh yeah, that makes sense. Well, if these extremes make sense, can the chronic illness of your child, can your personal chronic illness, can the instability of the world right now or whatever, can these be a blocking point to your body's healing? And that's where I kind of when I talk to people.
Well, what do the MACEs do? I mean, what did that study show, right? It showed that those individuals that had highest MACE scores or ACE scores were more prone to cardiovascular disease, cancer, metabolic dysfunction, substance abuse, mood disorders, suicidality, all of these things. So the more trauma you have, more stress you have, perceived or otherwise, early in your life, the more at risk you are for these events later in life. That doesn't mean it stops at childhood. It continues on throughout your life. And how you handle that depends on many factors, but reserves and resiliency come in. There's a lot that I think we're going to be touching base on with regards to this, but like from a scratching the surface standpoint, I don't think it's a hard sell at all anymore, because all I do is pull up their adrenal cortisol salivary test and say, this is you. And they're just like, I was sitting at home chilling that day. And that's what's going on with my stress loop. Yeah, that's what's going on with your stress loop.
Or like we were talking about before we started recording, you check your heart rate variability on your personal device, and you're like, I had a great day. I slept great at night, and your heart rate variability is
low,
25, 20.
Yeah.
And you're like, okay, so my heart rate went down, but there's no variability.
Beat variability
related to your
So the
breathing.
autonomic nervous system still needs work, right?
Yeah. So and then even like the idea that people have known for decades about stress-induced shingles. I wrestled when I was in high school back, 80, 89 to 91, or whatever those years were back in the day. It was common at the end of the wrestling season to see people getting shingles.
Yeah.
And we thought it was because of dirty mats. So we just cleaned the mats even better and got them wept down with these crazy chemicals that who knows what it was doing to us.
Making things worse.
Probably, yeah. But the thing was that when you train 2.5 to 3 hours a day and then go run 4 miles and do that 5 days a week for 2 to 3 months straight, at the end of that, some people, their immune systems break down. And so the idea that stress can increase your risk for infections, affect your immune system function, all these other things. I mean, for me, that becomes a selling point to convince people like you're not healing. We've done all this cool stuff. We've worked on your gut. We've worked on your hormones. We've got the mold out of the building. We've given you mast cell stuff. We're giving your salts and your stuff, your dysautonomia in your pots and whatever else is going on with your brain fog, whatever. And you're just not getting better.
Symptomatically,
right? Yeah.
Because I think that's key to discern too. In the same situation, I have these same conversations. Their objective data is getting better. So you're not just saying, I'm giving you stuff for your gut. I'm giving you stuff for this or that. You're proving that gut is better. You're proving that hormones are balanced based on at least objective data that was abnormal, that's now normal. And yet symptoms persist. So that's why clinical correlation is key, but also that typically is where that stuckness comes in, which is what you're describing, is that those patients tend to have some rooted limbic dysfunction that at that point in time needs to be worked. And sometimes it's at the beginning, because right off the bat, they're not tolerating any of the things. Like you can't even get to the point where you have the conversation about, look at all the cool stuff we did, because you can't even get past step one because they react to everything until you get them a little bit unstuck where they can tolerate some more to improve their physiology to then do the rest of that work. It's both sides of that coin.
So you said a word I don't think we've defined yet, limbic system.
Limbic, yeah.
So what is that?
So limbic system, the way I explain it is it's that kind of primordial part of your brain that entails the amygdala, the hippocampus, and the hypothalamus. So 3 really important structures. And the amygdala is mood regulation, the hippocampus is memory, and the hypothalamus, for me, the way I explain it is it's kind of like the sensory relay along with the thalamus that also is the coordinating point for all of the endocrine systems. So all your hormone loops, your thyroid loop, your sex hormone loop, even your adrenal loop is starting in the hypothalamus after the brain is telling it to do so, sends a message to the pituitary, to the target organ, makes some hormone, do your job, come back up and tell us, do you need more or less? But memory and mood is what we see a lot in these individuals. And, they're stuck in fight, flight, freeze, and they're not in that rest and digest mode, and they're moody, or they have mold rage and anger, or they're anxious, or they're depressed, or they're melancholic, and they're in their 30s and 40s and they can't remember anything, or we call it brain fog. And there's actually a way to measure this. We do neuroquantitative MRIs in some of these patients, and I see volume loss in these specific structures, mostly around biotoxins, but you see it with traumatic brain injury. We see it with a host of other things. So, that limbic system is so important. And when it gets dysfunctional, it's almost like the wiring in some electric device at your home or your car is not plugged in right or wired right. You have to literally unplug it and rewire it. And you could do that through the whole concept and process of neuronal plasticity, but it's hard work and it takes time.
Yeah, and something else to think about, like it's something I learned. I forget if I was reading some of Dr. Fogg's work or Dr. Cialdini's work. I'm in a group with both of those gentlemen, and they were talking. I forget which one it was, but talking about the idea of like your prefrontal cortex, your thinking brain, okay, and your emotions. And I like to think I'm a very logical kind of person, and I can just emotions, forget emotions. I'll just logically think through things. But it's interesting, like in the marketing world, they kind of realize that you can think everything through perfectly, line by line by line. But ultimately, you have to engage your limbic system, your emotional system, before you actually make a decision. Mm-hmm. And so a lot of times what's happening when people are making decisions in the marketing world, purchasing world, and also am I going to do this medical therapy that Dr. Jenski or Dr. Hartman just recommended to me, unless there's an emotional engagement, no matter how much brain is like, this is a great idea. Unless you have that engaged, you actually won't follow through. You won't actually, 80% of these decisions actually are emotional, not cognitive, which is fascinating because a lot of our patients, that whole system, part of their brain it's a wreck. And we wonder like, well, I told you all these really smart, cool things and you said yes. And I gave you the nice handout and sent you 20 pages of labs. And after the 30 vial lab draw, you're not doing anything. And it's like, and I knew early in my career, my first response was to get a little frustrated, but then I realized if this part of the system is dysfunctional, you can't actually engage, because of that, which is, I think, one of the reasons our more chronically ill patients have a hard time processing a lot of this stuff.
Yeah. Or they'll come straight out and say that they're not comfortable doing it because it's almost like they have a knee-jerk reaction. Then emotionality comes through right off the bat. Yeah. I mean, I see that all the time.
So let's get a little more granular before we go on to some other things. Let's talk about stress. I talk about physical, psychological, emotional. Let's talk also about some of the social historical effects of stress. And that's kind of like social history, like where you grew up, family dynamics. How do you, when you're doing it, when you're seeing someone, they're in the clinic, you're talking to them, how do you delineate if there's a historical stressor going on? Like when your childhood, the birth, were you in the ICU when you were a kid? Like where did you grow up? Were you in the military? How much did you move? Like what are some things you look at in this people's social history that are little clues that there might be a past event that's affecting their current stress status?
Well, I mean, the beauty is that we have a really thorough intake form. And a lot of these questions are asked, and if patients are willing to fill it out, they do. And sometimes you got to pull teeth, but most are willing because when they're making the commitment to come see us, whether it be financial or time-wise or just taking that leap of trying functional medicine, not knowing what they're going to get or expect, I feel like most of them are pretty transparent and open, but clearly some are still holding their cards a little close to their chest. And in these intakes, I review that section as importantly as I review their medical history, as importantly as I review their symptoms and their allergies and their medications. I think all of it's good. I think all of it's helpful, and all of it tells me more about the global nature of that individual. But it's anything from, birth history. Were you vaginal or were you a C-section? Were you premature? Did you have nuchal cord? Was it traumatic? If they know these answers. Were you breast or bottle fed? Did you have a lot of antibiotics as a child? In females, what was puberty like? When was your first menstrual cycle? Pregnancy history for a lot of my female patients. Did you have miscarriages? Did you have, complications with your pregnancy? A lot of them had postpartum complications. A lot of them had peripartum complications, relationship status, moving, like you mentioned. I have a lot of military patients, and that's clearly a stressor for many reasons. We also take an environmental history, and I garner or gauge some information about the other stressors that they might not be aware of, like, oh yeah, I've gotten multiple tick bites and no one's ever told me I had Lyme, or I had Lyme once and they gave me Doxy for 10 days and I'm good. Maybe not. Or I grew up in a moldy home, or I grew up in a water damaged building, or this is my job, and their job is something that is exposure to chemicals all day long, but they're not aware that they're being exposed to chemicals all day long. So it's the stuff that's clear and obvious, and it's sometimes a little teeth pulling, and as they gain comfort and understanding about what we're doing and why we're asking these questions, they'll open up more. And then a lot of it is me kind of deducing based on other little pieces of history that they have more stress than they're even aware of. And sometimes I have to show that to them. Like, this stuff that you didn't even realize was stressing you may not be mentally registering as anxiety or insomnia, but is absolutely affecting your body negatively. And if we don't do something about it, all the other stuff's going to be more difficult to get better.
Yeah. I think in part of one of the things with some of my patients is that sometimes it'll take a year and a half or 2 years seeing them over and over again for some of these things to pop up, because you re-see them, you re-question them. Then someone has a realization, actually, I never thought about the fact that, I was in the ICU for the first, 2 weeks of my life. Do you think that may have had an impact on some of my safety issues and my stress issues? Or, when I was a kid, my parents, this actually was something that's happened to some family members, where you have a parent that gets sick and they disappear for a month because they're at the hospital in some university for a month, and you're like, what's going on with them? These little things sometimes just don't register, and that's where I think the relationship as well with the patient is huge, because I have patients I've been working with for 4 to 5 years, and things are still popping up.
It's not even like in that situation they're trying to withhold
Oh,
information.
no, not at all. No,
they just don't realize it.
Yeah.
That's
sometimes I'll mention it. You'll be like, what? That's such a big thing.
Yes, right.
Oh
right.
gosh.
That massive aha moment.
Yes.
You're like, wait, what did I do? Nothing. You
Like,
gave me really good information without realizing it.
This actually changes everything now.
Yeah. All right.
So we talk. So I think right now metabolic. In the last couple of months, the idea of energy, good energy, metabolism has become a bigger issue. Let's talk about like your metabolic reserve. Some people refer to that as mitochondrial efficiency or mitochondrial health. How can your metabolism, poor sugar utilization, excessive sugar exposure, mitochondrial issues, which basically you have energy production issues. How can that serve as a source of stress? And mention mitochondria in this because I love that kind of stuff.
Yeah, I'm gonna start, but I'm gonna let you take over because I know you got good things to say about this. But it is, I think the starting point to answer this question is to just first clarify what mitochondria are and do. Mitochondria are well beyond the power plants of our cell, as we once learned in biochemistry if you took that course. And I think everybody kind of learns that they're the power plant. Like they make all your energy. They make our energy. That is still a true statement. That is just a minor function of what the mitochondria do for our bodies. Besides regulating your immune system, controlling inflammation, making energy, balancing oxidative stress, so your redox poise, affecting neurotransmission. There's just every hormones, every facet of your biology, the mitochondria, in my opinion, have some hand in. So therefore, if they're dysfunctional, all those other things have the potential to be dysfunctional. And when you're talking about metabolic health in general, if you're not metabolically healthy, we use the term flexibility a lot, metabolically flexible, then the reality is that you're chronically inflamed. The reality is that you're not good at utilizing food and turning it into fuel. You're not good at balancing your oxidative stress. And therefore the body's in a state of physiologic stress. That term stress keeps coming up. I just use the words oxidative stress. And that's not typically what you would even think of, but it's taxing the system. Therefore it's a stressor. And so when the mitochondria are dysfunctional for whatever reason, in our world, we see a lot of that related to biotoxins. So sick building syndrome, chronic infections like Lyme and others. That it, by its core, long COVID, these are all mitochondriopathies, in my opinion, that are not like the rare genetic ones that we learned about in medical school once upon a time, and that you will never see, rarely see, depending on where you practice. But this is the reality of what we're seeing every single day. And here's another little kind of way to look at it. What is perimenopause into menopause? It's your ovarian production of hormones going down. What happens first? Your mitochondria in the ovaries start to diminish and become dysfunctional. So as the mitochondria become dysfunctional, the ovarian production of hormones gets less and less and eventually shuts down. And now you're not making hormones and you're deemed to be postmenopausal. That started with mitochondrial dysfunction. You get that person's mitochondria right, perhaps their hormones balance for a little bit longer and that inevitable transition is delayed or at least softened to some extent. How would you kind of explain the whole metabolic mitochondrial thing with regards to stress?
Well, I think the mitochondria, in my understanding, is the root cause potentially
of everything,
of all chronic illnesses. Yes. And so if you don't make good energy, your brain doesn't work. And if that organ is the primary one affected, you get dementia. If your mitochondria don't work very well and the ovary is a primary organ, you might go through menopause when you're 38.
Premature ovarian failure.
Yeah. So even the understanding of cancer now. Dr. Thomas Seyfried wrote a whole book on cancer as a metabolic disease, and part of that is when the mitochondria become dysfunctional, the electron transport chain breaks down, which is how your body drops down a gradient electrons to then make energy. And if that basically separates, you get genetic instability. Well, what do you mean genetic instability?
Yeah, it doesn't sound good.
Yeah, genetic instability. And if you get enough genetic instability, your body can't repair it and you get cancer. So cancer actually, we've been thinking about cancer wrong for the last 70 years. And from Dr. Warburg talked about this in the 20s and 30s. So this information is not new. It's just we're getting a new understanding about how cancer actually, there are some genes related to it, but the vast majority
are metabolic or environmental.
Related to
both.
Related to mitochondrial breakdown, genetic instability. And so all of a sudden, like the stressors that affect how your body recoups, whether the chemical, environmental, play into things like cancer. And so now it's like, okay, we talk about stress after divorce, increasing a female's risk for breast cancer within 2 years. Now we understand like how that could play into mitochondrial health.
Right.
And all of a sudden, this is like, there are things we can do for this.
It also affects the metabolism of estrone, right?
Yeah.
So in addition to what you just said, in that same scenario of breast cancer, if a woman is still producing estrogen or taking estrogen, and she's stressed or inflamed or drinking because she's stressed, she's pushing all of her estrone down the 4-hydroxy pathway, and she's making DNA adducts and quinones if she's not able to methylate or reduce that, which is in English means she's making bad estrogen and not getting it out of her body, and eventually she's going to get an estrogenic cancer. So again, stress playing a role in multiple levels or facets in the same disease process. It's pervasive.
Yes. And so one of the things I want to make a little bit of a transition here, because we see patients with mast cell activation and chronic fatigue and fibro and mold and Lyme and all the rare stuff that
rare.
It's so rare that we only see it every day. But I lost my train of thought. But one of the things that's interesting with these individuals, like they'll be doing well and have like a little triggering event, and almost like they take 10 steps back. It could be an environmental trigger, like a chemical smell, scent, with this thing called tilt syndrome, which is toxic-induced loss of tolerance, which is a type of mast cell issue. Or they could get a mold hit, right? You go to a building, or they had 3 bad nights of sleep because they have an issue with one of their kids. Could you talk a little bit about those kind of stressors, those micro stressors that in and of themselves don't seem that big, but you have massive symptoms? Why does that happen? And what are some things people can be looking for when those things are going on?
I mean, it happens because I think in those situations, those individuals are also in a state of HPA axis dysfunction, which is the hypothalamic pituitary adrenal axis. So they're already at a point where maybe their limbic system is dysfunctional. Their HPA axis, that salivary cortisol curve, that influence, that morning spike that we want to see, and then it goes down throughout the course of the day, that counterbalance, that DHEA that we want to see, all of that is a little wonky or a little bit off. So they're starting to, or have already lost their resiliency to some extent, or lost their reserves. And although we're working to build that back up and they might be getting better, they're still in a tenuous state. In addition, for most of those patients, especially the mast cell patients, mast cells are ubiquitous and they are so easily triggered. And depending on the individual and what the triggering event is, it's just a histamine and inflammatory cytokine dump. And so in a moment of I feel good to I feel horrendous and I went all the way backwards, it's just a dump of histamine, inflammatory cytokines, mitochondrial dysfunction, and the resultant biological processes that makes that person feel unwell. These things are lining the GI tract. They're lining our blood vessels. They're at the surface of the skin. I mean, mast cells are everywhere. They go wherever they want to go. They're part of our innate immune response. I mean, they're part of our defense mechanism, but when they're overexcited, they are problematic at best. And they're causing a significant degree of dysfunctionality. I mean, that was my journey and still is. It's not like all of a sudden I just don't have mast cells anymore, or I have total control over my mast cells. Like I have much better control over my mast cells. I've identified my triggers. I don't always have control over my environment. I take things lifestyle-wise and supplement-wise that allow me to have that balance, but I know exactly what you're talking about. And my wife and I used to call those either adrenal crashes or histamine crashes, because I would be fine and I would come home and all of a sudden I had to lay down. And if I didn't lay down, I would literally fall down. And it was because there was an influx of either mast cells or inflammation, or it was because my adrenals just were so taxed that I just needed to crash. And then you would get that rest, you would build back up, you'd identify whatever the thing was, and you would work on trying to right that ship. But in certain specific populations, like our SIRS patients, which is the biotoxin patients, this is self-perpetuating because of the mitochondrial dysfunction and all the histamine genes that are upregulated. And we talked about this more in the SIRS series that we're not going to get into here, but this just then becomes a nightmare for those patients. I mean, how do you see it?
Well, I think with those triggering things, one of the things I think about is the whole, we talked about the mind body, the psycho-neuro-immuno-endocrinological axis.
Yeah.
And this is like the psycho-neuro, the mind neurological system. And so a stressor, your nervous system through your olfactory nerve or your auditory, hearing sensitivities, or whatever system's activated, your nervous system already has been traumatized from whatever. And all of a sudden, you have these small triggers cause a big neurological response, which leads to mast cells. So all of a sudden, what appears to be a small trigger, like a little whiff of walking down the aisle at Costco or whatever, or a little mold in your washing machine because the water sat there for whatever, and all of a sudden you have a flare as if when you first got ill. That's more the not for all people, but for a lot of people, it's their neurological system's survival mechanism. I think about, when I tell a story to patients a lot. When I was in fourth grade, I made some homemade wine because growing up in Harrisonburg, that's what you kind of do. I saw my brother do it, my older brother do it. And I'm like, all he did was stick some grape juice in a Coke thing with a balloon on top, and I can do that too, right? I didn't realize there's a little more process to it than that. And so I drank it and got super sick. Now, one of the good things about it was, so I got super sick. And so the smell of alcohol, the smell of wine in college would give me a nauseated, I get
visceral reaction.
I would be like, if you brought up a drink to me at a party, I would just have a negative response to you just internally, because I'm like, ugh, now that life event when I was in fourth grade actually served me well because it kept me out of trouble in college. But the point is, that's a survival thing. That's my brain having this little whiff from an event when I was in fourth grade saying, danger, danger, stay away. What happens with a lot of our patients is that gets hardwired, and now you get this disassociation. Now, related, unrelated stimuli. Maybe it's not that alcohol that caused the food, or the food poisoning thing, or the travel that gave you that giardia that started your illness, but it's the perfume from someone or something else like that. And so part of these people's hyperreactivity is a stress response, but it's a part of that neuroimmune kind of thing. And this is where, for these people, where the brain retraining is a big deal, whether it's, dynamic neural retraining, limbic retraining, primal trust, whatever that might be. So that's kind of where I see it.
Yeah.
There's a lot more nuances to it than that. But the point is, like, once you understand, when we talk about stress, we talked about this for maybe 30, 45 minutes or whatever, but like, that's what we're talking about. And so to take it home, just to kind of summarize, stress is a big deal. It can be a place where people's healing gets stuck and stopped. That includes all the things we talked about. We're going to kind of dive into this a little deeper, but my closing thoughts are that to convince people that stress can be a root cause, it can be a triggering mechanism for illness, or it can be a thing we call a mediator, which is the thing that keeps you stuck in your illness, or it can be all of those. And with a lot of our patients, it is a big player in their health journey, and realizing that, and then getting with someone that can help them walk through that and do different therapies can be a game changer for their healing process.
Yeah.
That's my take home on this. Do you have any parting thoughts on that?
I agree with that 100%.
Great. Awesome.
I think it's also resultant of this, and then it becomes self-perpetuating. Yeah. So it's an antecedent, it's a trigger, it's a mediator, it's the result of, and then goes right back to the front of the line, and it just becomes a loop.
Yeah.
Got to break the loop.
Great. So we're going to end today's episode there. We're going to talk more about stress, to get even deeper dive into some of these things here next time around. If this information was helpful to you, please like, share, subscribe below. And we will see you all soon to talk more about in the next episode, a deeper understanding of how can you actually do things to help you if you have stress as a major player with your health. Take care. We'll talk to you soon.